Hi, I'm Dr. Tamara Elzey. I'm a physical therapist and running coach, and I want to show you the hip stabilizer strengthening exercises that every runner needs to be doing. So the basic piece of equipment is just a stretchy band. This is about an 8-inch loop from the knot to the end. If you're using, this is TheraBand is the brand. You can use any brand of stretchy band. Some actually come already in a loop. This one came in a long section. It was about a 2-foot section, and that's tied a knot, so we end up with an 8-inch loop. The different colors of band represent different resistance. This is kind of a medium resistance. And we're gonna take this and put it around your ankles. Oh, don't lose your balance. Easy for me to say. Okay, now that we're safely upright again, it's nice if you have on socks or pants so that these stretchy bands don't like pull your skin, because that just doesn't feel very good. When we're doing the first exercise, I want you to keep your knees straight and to hike your hip up on one side to get your foot up off of the floor. So you're standing straight, both knees are straight, hike one hip up, and this is our starting position. So one foot's off the floor, and you're going to take your leg out to the side and back together. Now, I need you to be really careful. There are super common compensations that our bodies do because our bodies are incredibly smart. When you start to do this, I need you to watch your toes, because your body is going to want to use its strongest muscle, which is its quad, not this little muscle on the outside of the hip. So it's going to like wing your toes out to the side. I need your toes pointing straight ahead the whole time. So really slow, deliberate, going out to the side and back together. The other thing your body's going to want to try to do is use momentum. So this doesn't count. That is not okay. I need you to slow it down, really deliberate, out and back together. And the last part of it is your shoulders stacked on top of your hips. I don't want your shoulders going to the side. Oh God. This is so tough. This exercise has been proven. There's so much research now that shows a correlation between hip stability strength and knee pain with running. So the weaker your hip stabilizers are, the more knee pain you're gonna have with running. So I cannot stress how important strengthening this particular muscle group is for running. And I'm pointing to this side because although this leg is the one that's moving, it's these hip stabilizers that's holding everything up. If this hip isn't strong enough, then we're gonna drop down like this. That's actually what you see with runners that don't have really strong hip stabilizers, is their opposite side drops. And we really, really don't want that for so many reasons. Want to be really strong in the hip stabilizers to protect your knees. So hips up, foot out and back together, really slow and controlled. And oh my goodness, this is no joke. I mean, seriously, this little stretchy band, I think I'm gonna break a sweat, and I've done like 3 reps. So then we'll go over to the other side. You would do 10 on one side, switch to the other side. Same thing, pay attention to your hips. Knees are straight, hike that hip up, and then leg out and back together. We'll see if I can go ahead and do 10. So that's 2. I lose count. I can't keep track. 3. Oh my gosh. Can you see my legs shaking? And I already lost count. I think that was 5. Maybe I won't go through all of them. So really slow and controlled. Don't let your toes wing out to the side. There is no way I'm going to be able to finish all these. I did a crazy workout this morning. My quads are all like jello right now. Anyway, we're going to do 10 reps on each side, and you're going to do this twice starting out. So core really engaged, keep this all really still so shoulders aren't moving at all. Nothing. I think about it like From my head down to the leg I'm standing on is like one piece. This leg is doing its own thing. So nothing head, shoulders, core, hip, leg on this side. Nothing over here should be moving. This leg, oh my gosh, was doing its own thing. So then we'll go back to the other side. Always start by hiking that hip, leg out and back together. See how this like head, core, leg, it's all one piece? This is crazy. I'm so shaky. So that's the first one, going out to the sides. You would do sets of 10. If you can do 2 sets of 10 starting off, that's awesome. Strengthening hip stabilizers is just like strengthening any muscle group. You're going to do that 3 times a week is perfect. You could work up to doing 3 sets of 10, 3 sets of 15. That's really as much as you would need to do is 3 sets of 15. That would be amazing. I mean, you saw me just do like 6 repetitions and I'm already a little tired. The other one, I'll show you from this side. This one is a little easier. You don't have to be as particular about how you do it, about the direction it goes in. But core, really engaged, same thing, hike the hip up. But this time you're gonna go diagonally to the back. The whole focus is on this part of the muscle right here. So core stays still. This part right here needs to contract, right there. If you put your hands on your hips, kind of low on your hips, where your thumbs are right here, that's the muscle that we're looking to have contract right there. And with this one, it's not as important, the position of your foot. It's really just to get that muscle to engage back there. I kind of think about it like I'm actively trying to push my pelvis forward. It's a balance exercise too. But when you squeeze your cheek, I think about it like I'm trying to push this part forward, and that gives me a really good strong contraction here. But not arching your back. This part stays still. Man. So I think that I'm pretty strong. I'm doing some like pretty awesome workouts and I'm running consistently, and still, oh my goodness, this is tough. This little stretchy band is no joke, and it is so important. So it would be the same thing with that. Do 2 or 3 sets of 10. Start off just doing 2 sets of 10 and really slow and controlled. Core stays still. Body and the leg I'm standing on is just completely still and stable. It's not moving. Then you switch over to the other side. Really focus on where you're getting that contraction. So really strong, kind of outer back part of your hip, your glute, should be contracting back there. So that is the basic, most important way to do the hip stability strengthening. And I want you to be able to do it that way first. But then I get bored and I want to do something different sometimes. And there's some benefit to kind of switching up your routine. I want you to have the basics of how your body is supposed to move so that you're not compensating. Once you know for sure that you have those basics, that you can keep your body really still and stable and do the exercise out to the side, you're not letting your toes wing out to the side, you're keeping both knees really, really straight. As long as you know how to do each of these, then I actually like doing what's called monster walks, because you get a little bit more of the front kind of muscle hip stabilizer as well. For this one, it's basically the same thing, but you're gonna be traveling with it. So it'd be like 10 steps forward and 10 steps back, and doing that, twice. That would be your 2 sets of 10, and then side step as well. So when you're going forward, it's your foot goes forward at a diagonal. I still don't want your toes pointing out to the side. Toes have to be pointing forward. So a diagonal to the side, then I'm going to bring this leg a diagonal up together, but I'm not going to put this one on the floor. It just kind of brushes next to the one I'm standing on, and then it goes out here. And remember how we were saying the leg I'm standing on and my body is one part, then this comes together and this goes apart and then I step on it. And this comes together, this goes apart, and I step on it. So you want to stay on top of the leg that you're standing on, so your body and that leg is all one part. Then you go backwards with it, and same thing, diagonal together, diagonal back, and then step on it. Diagonal together, diagonal back, and then you shift your weight onto that leg. Yeah, and slow and controlled is really important. Man, whew, this is an awesome hip workout. The final one, because I still want you to do the work on the side stepping, is just body and leg as one. This leg goes out by itself, and then you step on it. This comes together, this goes out, and you step. What I don't want to see with sides is this. Please don't do that. It's not helping anything. Body and the leg you're standing on completely still. This leg goes out and then you shift your weight onto it. Now that my body weight is over this leg comes back together. So you have to be really methodical about this. Slow, methodical, pay attention to always having your body stacked on top of the leg that you're standing on so that that other leg is moving by itself. This one, I tend to wait for a while to give my clients this exercise because it's so easy to do this. And I don't want any body swaying. It doesn't help. So that is your hip stabilizer strengthening exercises. This really should be like the foundation of every runner's strength training program 3 times a week. I mean, it's a stretchy band. You can throw it in your car, in your lunchbox, whatever, so that you have it with you and you can do it anywhere. And truly, you can go through the whole thing in like 5 minutes. It does not take much time, and the benefit of it is phenomenal to have good, strong, stable hips so you have safe, pain-free knees when you're running.